Let me begin with something most people don't expect. Kidney failure rarely announces itself loudly in the beginning. It doesn't come crashing in with unbearable pain or dramatic symptoms that force you to rush to a hospital. Instead, it whispers, it shows up quietly, subtly, in ways that are easy to dismiss, easy to overlook, and unfortunately, easy to normalize in our busy lives. You start feeling tired, not the kind of tired that comes after a long day's work, but a deeper, more persistent fatigue that doesn't go away with rest. You wake up in the morning and still feel exhausted, as if your body didn't recover overnight. Many people blame this on stress, lack of sleep, or simply getting older. But what they don't realize is that when the kidneys begin to lose their efficiency, toxins that should have been filtered out start accumulating in the bloodstream, and that buildup slowly drains your energy from within. Then comes the difficulty in focusing. You may notice that your concentration isn't what it used to be. Simple tasks feel harder to complete. You forget things more often. Your mind feels foggy. Again, this is often brushed off as mental fatigue or distraction. But there's a deeper mechanism at play. When waste products remain in the blood, they begin to affect brain function. The clarity you once had starts to fade, not because you're incapable, but because your internal filtration system is struggling. Another early signal is a subtle change in appetite. You don't feel as hungry as before. Meals that once excited you now feel unappealing. Some people even experience a metallic taste in their mouth, though they can't quite explain it. This isn't random. It's your body reacting to the imbalance of chemicals and toxins that your kidneys are no longer regulating properly. And when appetite decreases, nutrition suffers, creating a cycle that further weakens the body. What makes these signs particularly dangerous is how ordinary they seem. Fatigue, poor focus, low appetite, these are symptoms almost everyone experiences at some point. And that's exactly why kidney disease often progresses unnoticed. People adapt, they push through, they tell themselves it's nothing serious, but beneath that assumption, the condition continues to develop. You see, the kidneys are incredibly resilient organs. They can compensate for a loss of function for a long time before the symptoms become obvious. By the time more severe signs appear, significant damage may have already occurred. That's why these early, quiet warnings are so critical. They are not just minor inconveniences, they are signals that something deeper may be going wrong. And here's the important part. Your body is always communicating with you. It doesn't stay silent without reason. When energy drops, when focus declines, when appetite changes, it's not just about lifestyle or routine. It can be your body asking for attention, asking for investigation, asking you to pause and listen. In my experience, the difference between early intervention and late stage disease often comes down to awareness. The people who catch these signs early, who take them seriously, who seek evaluation, they give themselves a chance to prevent progression. They give their kidneys a chance to recover or at least stabilize, but those who ignore these whispers often end up facing much louder consequences later. So the question is not whether your body is sending signals. The question is, are you paying attention? Because the earliest warnings don't shout, they whisper, and only those who listen carefully can hear them before it's too late. Now let me take you a step further, because after those silent internal signals, the body begins to show you something more visible, something you can actually observe if you're paying attention. And that is changes in urination. This is not just a random bodily function. It is one of the most direct reflections of how well your kidneys are working. Think about it. Your kidneys are essentially filters. Every day, they process large volumes of blood, removing waste, balancing fluids, and producing urine as a way to eliminate what the body no longer needs. So, when something starts to go wrong with the kidneys, one of the first places it shows up is in the urine itself. Now, many people don't pay attention to their urination habits unless something becomes extremely uncomfortable. But the truth is, even subtle changes can be meaningful. For example, you may find yourself going to the bathroom more often than usual, especially at night. You wake up once, then twice, then maybe even more. You might think it's just because you drank more water, or perhaps it's related to age. But frequent nighttime urination can be an early indicator that the kidneys are struggling to concentrate urine properly. On the other hand, some people notice the opposite. They are urinating less. Despite drinking fluids, the output seems reduced. This can be a sign that the kidneys are not filtering blood efficiently, leading to decreased urine production. It's not something to ignore, because it suggests that the body is retaining what it should be eliminating. Then there's the appearance of the urine itself. This is something people rarely observe, but it can tell you a great deal. If the urine becomes dark, unusually concentrated, or tea-colored, it may indicate dehydration or the presence of waste products that are not being properly filtered. If it appears foamy or bubbly, that can be a sign of protein leaking into the urine, a condition that points directly toward kidney damage. And sometimes there may even be blood in the urine. It may not always be obvious, but even a slight discoloration should never be dismissed. Blood in the urine is not normal, and it requires immediate attention because it can signal underlying damage within the kidneys or urinary tract. What's important to understand here is that these changes don't happen randomly. They are the result of a breakdown in a very precise and delicate system. The kidneys regulate fluid balance, electrolytes, and waste removal with remarkable accuracy. When that system begins to fail, the imbalance reveals itself through these visible signs. But here's where people often make a mistake. They normalize these changes. They adapt to them. They start planning their day around frequent bathroom trips, or they ignore the color and consistency altogether. And in doing so, they miss the opportunity to catch a problem early. Your urine is not just waste, it is information. It is feedback from your body, giving you real-time insight into what is happening internally. And unlike fatigue or loss of appetite, this is something you can actually see, something you can track, something you can act on. In clinical practice, I have seen countless cases where early detection could have made a profound difference. A simple observation followed by a basic test could have slowed or even prevented progression. But when those signs are ignored, the condition continues silently, moving from a manageable stage to a much more serious one. So I want you to shift your perspective. Don't think of urination as a routine, insignificant act. Think of it as a window into your health. Pay attention to frequency, volume, color, and consistency. These are not trivial details, they are signals that your body is giving you every single day. And when those signals change, even slightly, it is not the time to guess or assume. It is the time to investigate, to understand, and to take action. Because, sometimes, the clearest warnings are the ones we see every day and still choose to ignore. As this process continues, the body begins to show signs that are no longer subtle, no longer easy to brush aside. What was once internal and quiet now becomes visible, and one of the clearest ways this happens is through fluid buildup, through swelling that you can actually see and feel. You may notice that your shoes feel tighter than usual. Your ankles appear a little puffy at the end of the day. You press your finger against your skin, and it leaves an indentation that takes time to go away. At first, it seems minor. You might think you've been standing too long, or maybe it's just fatigue. But as days go by, the swelling becomes more noticeable. It starts to involve the feet, the legs, sometimes even the hands and face. This is not just a surface issue. This is your body struggling to maintain balance. Under normal conditions, your kidneys carefully regulate how much fluid stays in the body and how much is removed. They maintain a delicate equilibrium, ensuring that your tissues are hydrated but not overloaded. But when the kidneys begin to fail, that balance is disrupted. Excess fluid that should have been filtered out starts to accumulate, and it has to go somewhere. So it settles in the tissues, leading to what we see as swelling. Now, gravity plays its role. That's why many people first notice it in their lower limbs, the ankles and feet. But as the condition progresses, the swelling doesn't remain limited to one area. It can move upward, affecting the legs, the hands, and even the face. Some individuals wake up with puffiness around the eyes, not realizing that this is also a form of fluid retention. And here's what makes this particularly concerning. It's not just about appearance or discomfort. This fluid buildup can begin to affect how your body functions. When excess fluid accumulates, it places additional strain on the heart and lungs. Some people start to feel shortness of breath, especially when lying down. Others notice a heaviness in their chest or a reduced ability to perform simple physical activities. The body, in essence, becomes overloaded, and yet, even at this stage, many people still hesitate to take it seriously. They may try to manage it on their own, reducing salt intake for a few days, elevating their legs, or simply waiting for it to go away. While these measures may offer temporary relief, they do not address the underlying issue. The root cause remains. The kidneys are no longer able to regulate fluid effectively. There's also a psychological aspect to this. Visible swelling is often dismissed because it doesn't always cause immediate pain. It's not sharp, it's not dramatic, and it doesn't demand urgent attention in the same way other symptoms might. But that's exactly what makes it dangerous. It progresses quietly, gradually increasing, reflecting a deeper and more serious dysfunction. In many cases, by the time swelling becomes persistent and widespread, the kidneys have already lost a significant portion of their function. This is why recognizing and acting on this sign early is so important. It is no longer a whisper, it is the body making itself clearly known. I often tell people to observe their bodies with intention. Look at your ankles at the end of the day. Notice how your rings fit on your fingers. Pay attention to your face in the morning. These small observations can reveal patterns, and those patterns can tell you a story about what's happening internally. Because the body doesn't create excess fluid without reason, it doesn't hold onto what it should release unless something has gone wrong in the system designed to manage it. And when that system is compromised, the consequences extend beyond swelling. It becomes a sign of strain, of imbalance, of a body that is no longer able to maintain its internal environment the way it should. So when you see swelling, don't just think of it as a temporary inconvenience. Don't reduce it to something cosmetic or harmless. Understand what it represents. It is a signal that the kidneys are struggling, that fluid is accumulating, and that the body is under stress. And the sooner you recognize that, the sooner you can respond in a meaningful way. Because when the body begins to hold on to what it should let go, it's telling you that something is no longer working the way it's meant to. As the condition progresses further, what began as subtle internal changes and then visible physical signs now reaches a stage where the entire body begins to feel the burden. This is the point where toxins, which should have been filtered out day after day, start accumulating in the bloodstream. And when that happens, the effects are no longer limited to one system or one area of the body. It becomes a whole body experience. You may start to feel persistently unwell without a clear explanation. There is a sense of heaviness that doesn't go away. Nausea may begin to appear, sometimes mild, sometimes more pronounced, often without any clear dietary trigger. Food that once felt normal may suddenly become unappealing, and in some cases there may even be vomiting. These are not isolated digestive issues, they are signs that waste products are building up in the body because the kidneys are no longer effectively clearing them. Another common but often overlooked symptom is a change in the skin. People begin to experience intense itching without any visible rash or allergy. They scratch, they apply creams, they try antihistamines, but nothing seems to fully resolve it. This itching is not coming from the skin itself, it is coming from within. It is the result of toxins circulating in the blood, irritating nerve endings throughout the body. And because the root cause is internal, external treatments often provide little relief. Then there is the breath. Some individuals notice a distinct change in the way their breath smells. It may develop a foul or ammonia-like odor. This happens because waste products that should be excreted through urine are now being expelled partially through the lungs. It is the body's way of compensating, of trying to eliminate what it can through alternative pathways. As these toxins continue to accumulate, they begin to affect energy levels even more profoundly. The fatigue that once came and went now becomes constant. Even simple tasks feel exhausting. Walking short distances, climbing stairs, or carrying out routine activities starts to require significant effort. The body is no longer functioning efficiently because it is operating in an environment filled with its own waste products. Breathing itself may also become affected. Some people experience shortness of breath, especially during physical activity or when lying flat. This can be related to fluid overload, anemia, or the toxic effects on the respiratory system. It creates a sense of restriction, as if the body is no longer able to fully expand and function freely. And perhaps one of the most concerning aspects of this stage is its gradual nature. The changes do not happen all at once. They build slowly, layer by layer, until the body reaches a point where it can no longer compensate. People often adapt to each new symptom as it appears, without recognizing that they are all connected to the same underlying issue. This is what makes kidney-related toxin buildup so dangerous. The body is remarkably adaptable, and that adaptability can sometimes delay recognition of a serious problem. By the time symptoms become severe enough to demand urgent attention, significant damage has often already occurred. What must be understood is that these are not random, unrelated issues. Nausea, itching, breath changes, fatigue, and breathlessness, they are all expressions of one central problem: the inability of the kidneys to properly filter and eliminate waste. The body is essentially trying to function in a state of internal imbalance. At this stage, medical intervention becomes not just important, but essential. The focus shifts from early detection to managing complications and preventing further deterioration. But even more importantly, it highlights how critical it is to recognize earlier signs before the condition reaches this point. Because once toxins begin to dominate the internal environment, the body is no longer just signaling a warning. It is struggling to maintain basic equilibrium. And when the very system designed to cleanse the body begins to fail, every part of the body begins to feel the consequence.